Hi guys, let's have a small clinical based discussion. A 40-year-old male patient, few days after a small surgery done to his parotid glands, he complains of sweating over the area of this parotid gland whenever he eats food. What could be the most probable diagnosis? Yes, Frey syndrome. What is Frey syndrome? An aberrant connection between the auriculotemporal nerve supplying the salivary gland and the sweat glands which supply the skin over this parotid gland. What might have happened is a probable injury to his auriculotemporal nerve during the parotid gland surgery, and when it heals, it reattaches to the sweat gland supplying the area over this parotid gland. That is why whenever he eats food, there is salivary secretion inside his mouth and sweat secreted outside. This is called Frey syndrome.